Hello, this is Dr. Do again. This video is still on alphabetic list problems on letter T. Today I'm going to talk about the thrombotic diseases. Probably it's just different term for you, the diseases that you probably very well familiar with, such as the stroke, the heart attack, or the DVT. You already probably heard DVT is more than deep venous thrombosis. And there's another one is mesenteric ischemic cause infection of the small intestines or intestines. So these are they are all the and also the pulmonary embolism, of course, P. So these are all the thrombotic diseases in this from head to toe, from the brain like stroke and the lung pulmonary embolism, and also the heart myocardial infarction, and also the intestines, the mesenteric artery ischemic by the thrombi, it's also called thrombotic ischemia, and also the deep venous thrombosis. So these are the major resources or causes for this, the consequences for this thrombotic diseases. Basically, it's just I give you. First of all, let me just bring up the emergency situation. On any emergency situation associated with this thrombotic diseases, of course, pretty much all of them are emergency, because the thrombosis is itself, for example, the DVT itself, the deep venous thrombosis, to the leg is just swelling, because there's so many the branches just connect together, so the blood supply is not cut off. So still continuously to supply, just the swelling from the inflammation, local inflammation caused swelling. And you imagine this, the veins from the leg, it's like from the end, a small blood vessel going to the larger one until the vena cava, inferior vena cava, which is wide open. So the pathway is no resistance, just going through back to where? To the heart, to the right atrium, and then right atrium to the right ventricle, and the right ventricle to the pulmonary artery. Then go to the lung, the small blood vessels, then stuck there, cause the thrombosis, cause the pulmonary embolism. So that's the example for this course, pathological course. The same idea for the brain or heart. Anyway, so are there any emergencies? I think they are all. But just what are the signs? You already mentioned so many times for the stroke, any newly developed muscle weakness, lost sensation, speech problem, or limb on any extremities, limping on any extremities or limbs, and so that's just especially for those who had pre-existing or past medical history of comorbidities like hypertension, hyperlipidemia, diabetes. Those are notorious diseases. We have to talk about it every day, because the consequences is so severe and could be the life-threatening. So these are of course, the myocardial infarction, the heart attack. It's also, I mentioned so many times, what are the signs you look for? You know it is heart attack. Chest pain can be many causes, but not all the chest pains are myocardial infarction. But I think that's just the prioritize, because the myocardial infarction is the worst life-threatening situation. So we consider for those older people, particularly mention those three notorious: hyperlipidemia, diabetes, and hypertension. If you develop heart chest pain, do not hesitate. Probably it's not a heart attack, but just in case, consider the prioritize. Just go to the emergency to check it. If it is just muscular or just chest wall or any other things, but you're lucky, we're celebrating. But at the same time, do not ignore those life-threatening situations. Do not let it pass by. So go see your physician right away, immediately. So you know the signs. The crushing chest pain, and also related to your left shoulder or left small fingers, and particularly if you after the exertion or exercise or doing something, use your arm, doing something heavy loaded for your upper extremities. So these are the signs of myocardial infarction. For the pulmonary embolism, the signs sometimes could be subtle. If you have, without any cause, you just feel your heart beating faster, and also your leg swelling, that's pretty much with high sensitivity and specificity, that probably indicating the pulmonary embolism. Because pulmonary embolism is not like others diseases like acute hypoxia. This is kind of, the symptoms quite be subtle, but the consequences could be severe if not treated on time, not diagnosed on time. So that's and also may or may not have breathing difficulty, usually not, but just the symptoms for this pulmonary embolism, it's really subtle, just probably heart beating faster, may or may not have fever, but if the leg swelling associated with this heart beating fast, and also with past medical histories, again, those hyperlipidemia, obesity, diabetes, hypertension, again, so this, if that's the case, or then probably indicating you might have pulmonary embolism, and anyway, go get it checked just in case. So this is about and also the mesenteric ischemic. It's quite a chronic, subtle process. Usually it's not completely cause the infarction immediately. Just the localized, probably just one layer of this intestinal wall getting ischemic and feel the abdominal pain. Those pains kind of subtle. It's not like appendicitis, or not like an ulcer, not like the perforation. The abdominal pain from the mesenteric ischemic is kind of subtle. The pain you feel very bad with the food intake. But during the exam, you press it, you couldn't find anywhere where is the pain come from. You couldn't identify. For example, appendicitis or cholecystitis, we know right upper quadrant or right lower quadrant, they have the local pain with your pressing, but this mesenteric ischemic caused the infarction of the small intestine, or localized local layers. It's not like that. It's chronic, and it's not like acute abdominal acute abdominal diseases. But this is subtle in older people. If you have this kind of pain associated with food intake, you lose weight, and when you press it, you couldn't feel anywhere pain. That's probably indicating you have it. So that's the for the small intestine. For lower extremity, the DVT, like I mentioned, even though the consequences for the legs, you're not going to lose muscles, you're not going to lose the limb, but the consequences go back to the lung. That's the worst, and a lot of times just the life-threatening for this pulmonary embolism. So if you have one leg is bigger than the other, and feel swelling and change color. So if that's the case, particularly young female, obesity, and taking the estrogen or taking the contraceptive pills, that's increased, or the long-term immobility, that increased risk for older people also. So this is about the video for the thrombotic diseases. I just put everything together. So I hope that it just reminds you to keep healthy lifestyle and see your physician in time fashion. So I'm going to stop here. Thank you for watching. I'll see you next time.